Dr. Snigdha Chitnis, and I'm the category manager here at Medvarsity. I'm right now in conversation with Dr. Sai Praveen Harnath, and we'll be talking today about respiratory failure. Given the current situation, pandemic situation, there are a lot of geriatric patients who are, ending up hypoxic and on ventilator, as one of my friend's grandmother just did. Do you think she aspirated something, or it was normal pneumonia? What do you think was the case?
Sure. Thanks, Dr. Singh. I'm Dr. Sai Harnath. I work at Apollo Hospitals. I do lungs and critical care management. And we've actually been seeing in the COVID crisis, several elderly people end up on ventilators, unfortunately. And if you kind of look at ventilators itself, the ventilator is really a support device for somebody who can't breathe very well. And the reason for going on a ventilator can be variable. It can be something like heart failure. It might be a pneumonia, like you mentioned. And aspiration pneumonia happens often. And aspiration pneumonia is where people can't really swallow, and then the food kind of ends up in the lungs, and then it ends up triggering an infection. You can also have the regular community acquired pneumonia where patients inhale bacteria and then the bug grows and you end up with a pneumonia. A lot of people can actually get pneumonia prevented if they're vaccinated, by the way, like influenza, pneumonia vaccines are all available. But when you end up with a pneumonia, you kind of want to understand why this patient ended up with a pneumonia and were they sick before. For example, if they're a diabetic and their sugars are high, then you might end up with a very serious infection. There are studies which have shown that if your sugar goes about 250, they've actually looked at WBC eating bacteria up. They don't move. Once the sugar hits 250, they just get paralyzed. So it's important to control the glucose. And you heard this mucor crisis, right? The black fungus crisis. And a lot of it has been related to people with out of control diabetes. So it's very important to control the diabetes, especially if you're a diabetic. And elderly people also have changes in their swallowing reflex. So that might trigger aspiration. In the COVID crisis, what we have seen is many people are initially on non-invasive ventilators where you can actually try them off on a mask to help breathe. But after a while, if their lungs get affected, you can't manage just the non-invasive device. You have to put them on a ventilator with an endotracheal tube. Now, just rewinding back a little bit. So the basics of the human lung, as you know, the human lung is the size of a tennis court. If you stretch it all out, it's about 75 square meters. And if you actually looked at what the lung does, all it does is gets in oxygen, blows out carbon dioxide. But if you end up with an infection and parts of the lung are actually filled with fluid, you can't do this gas exchange and your tennis court becomes a table tennis table. So you don't have enough space to actually do the breathing. And luckily the body has a lot of response to anything like an infection. Your heart rate goes up, you breathe fast, but patients can't keep breathing fast. You get tired, right? You get exhausted, the muscles get exhausted, then you slow down your breathing because you're not alert enough. Carbon dioxide goes up and then you need to be on a ventilator. So when you look at people with respiratory failure, you always want to find out what made them get worse. So like your friend's grandmother who unfortunately ended up on the ventilator, we are thinking that maybe she got too tired with the infection, wasn't able to breathe on her own, part of the lung got affected, and it was not able to do the normal role that the lung does, which is get oxygen, blow out carbon dioxide. Now, if you looked at an intensive care unit and you walk in, you'll see people on ventilators, on the non-invasive machines. You'll probably see people only on oxygen, some people on, just sitting down there. And if you look at the whole spectrum, respiratory failure occupies a large part of critical care. And if you actually know how to manage patients with respiratory failure, you've kind of achieved a lot in critical care. If you know how to use the non-invasive ventilator, if you know how to do the actual ventilator. And I know there are several courses, but it's very good to really spend time in an ICU if you can, because once you spend time in an ICU, really understand what these machines do, it's much easier to manage patients.